There are so many phenomenal women in this room, and one of them is our first speaker of the day, Prof. Dr. Marlene Tamaman, Mama Daktari, as she is referred by some people.
Today is the launch of a very important program on small vulnerable newborns. This is actually a research series publications in the Lancet, where we have 5 publications about what is this concept of small vulnerable newborns that are preterm born, too small, too early, or stillborn. So there are many in the world. We have 1 out of 4 babies is a small vulnerable newborn. And in this series, we talk about what is the magnitude of the problem, trends over time, because honestly, we have not made a lot of progress. 10 years ago and now, about the same numbers of preterm birth, small vulnerable newborns. So then we also look at what can we do better, what have we learned. So this is what we are putting our heads together here.
It is very important to prevent small vulnerable newborns, because if they are born too early or too soon, they have a lot of consequences in terms of the development, in terms of mortality and morbidity, and long-term impact on society and the national economy or national development. So we need to invest on them so that we support normal development of the nation.
I'm going to be talking a little bit about things about data, which is usually quite boring, but I think it's important.
It is important in Sub-Saharan Africa, particularly because that's where most of the burden is. Looking at some of the work we've done and the numbers, 80% of the small vulnerable newborn types are particularly in mostly Sub-Saharan Africa and Southern Asia. We've seen from the latest statistics that actually there's been little or no progress or changes in some of these vulnerable newborn types in Sub-Saharan Africa and even in Africa, and more specifically even in Kenya.
I think what we need to do first of all is understand what's happening. That's where our research can come in, bringing some of our methods and techniques to try to measure, look at the impact, and then actually reach out to a whole range of other people to work together to try to get some of our learning out there. I mean, academics can do their bit, but they need to work in partnership with others, particularly if we want to make that message effective.
Kalikuwa kadogo sana. Hata wengine walikuwa wananiambia nimezaa panya, wengine walikuwa wananichekelea. Nilikuwa nasikia vibaya sana kwa sababu sikutaka mimi mwenyewe kuzaa yule mtoto. So mtoto wangu aliwekwa kwa incubator pale, pia hapakuwa pazuri hivyo. Maana safari yangu na huu mtoto akiwa 1.7 mpaka sasa hivi 1 year 11 months haijakuwa rahisi. Pale katikati kuna magonjwa. Kuna wakati ilifika ile miezi inatakana mtoto akae, yeye hakai, ukimkalisha hako. So nikapitia mambo ya physiotherapy, mambo mengi tu hapo katikati kitambo fika, haijakuwa rahisi. Sasa hii tuko sawa, tuko chonjo kabisa, hatuna shida, magonjwa yalisha, sisi tunaishi tu vizuri.
That time tulizaa wamama wengi, na ukisikiza wengine mkiongea story, cause mkienda pale wamama mnakuwa marafiki, mnakuwa ni kama mko shule. Unasikia wengine wakisema mimi naweza acha huyu mtoto, mimi naweza nyonga kakufe ni kadogo. Sasa vile nilidistajiwa, pia nikakuwa na hiyo morali ya kuenda kuambia kuzaa preterm ni kawaida, na watoto wana grow na wanafanya vizuri.
Yes, there is one specific case that I can remember back in the year 2018. It was a preterm baby who was weighing 650 grams at birth. And this is the time when Pumwani was just picking up with kangaroo mother care. And this baby was able to survive. This baby was born with 650, dropped all the way to 550 grams. And we were able to discharge this baby after 2 months with 1.8 kgs. And this is a baby who is thriving and is around 6 years now.
UNFPA is really focusing on maternal health, but of course, as we have seen in the presentations today, and we are very grateful for Aga Khan and for all the work that is being done, is that if you have a very healthy mother, you will have a healthy fetus and you will also have healthy babies. So our focus is to make sure the mother gets the antenatal care, get good nutrition, gets family planning, doesn't have an early onset of pregnancy, it's delayed, have spacing between the pregnancies, to make sure that when she decides, and it's about her choice, then she has a healthy baby when she decides to have one.
The role of the government is to, one, make sure that we set policies and guidelines that are going to help us to roll out the same to the facilities where the actual treatment of and management of these patients are being done. That is the hospitals, the health facilities, the dispensaries. And by doing this, we have a mandate according to the Constitution to develop guidelines, policies, and disseminate them. Dissemination, I mean, whereby we are able to roll out these guidelines to the health facilities or to the healthcare workers, and making sure that we follow up through to make sure that they are actually being implemented through a monitoring process, which as a national government we are entitled and mandated to do by the Constitution.
First of all, county governments, our role is also to advocate and implement the recommendations that are coming from this series of work that is being done. Because there are a number of potential, interventions that are recommended, and those which are the proven and the potential ones. So, as county governments, is to really look at what we can adopt and provide to our people to make sure we are giving them the best quality of care. This is one to the mothers in a preventive approach. Of course, in a also treatment, in a curative approach to also these preterm births. How well do we take care of them to make sure they transition for the recovery, to have a normal growth or a normal upbringing?
I really hope that it develops and moves on to something much bigger than just the series itself. And I think that's where the real challenge is. How can we engage the hearts and minds of people out there in society, not just governments, but wider civil society? So that's my hope, that we can sort of galvanize some real change.
It's very important to prevent small vulnerable newborns, because I think this is what gives us the granularity or vulnerability according to newborn types. This is the first time this has been done, and I think it's really exciting and pushing the needle. It gives us better understanding of where the vulnerability lies.
What do we do to prevent it, and how do we play a part in? Government agencies, non-government agencies, all of us need to play a part in this.
Mama mwenye amepata mtoto mdogo kama mimi, nafaa kwanza vile utakavyoambiwa na madaktari jinsi ya kumlea yule mtoto, wafuate tu masharti ya kumlea yule mtoto. Usisikize tu maneno ya watu, maana watu wana maneno mengi, mengine ni positive, mengine ni negative. So wewe focus kwa mtoto wako.
Nitajitolea kuongelesha wamama wenye wako na mimba na wamama wenye wamezaa watoto wenye hawajafikisha. Thursdays niko pale nikiongea na wale wamama wako na mimba. Once umejua uko na mimba, tembelea clinic, enda skani, na wamekuwa wakifanya hivyo na mambo imebadilika.
I hope that this SVN framework, the Small Vulnerable Newborn Consortium initiative, will be a new rallying call for all of us to really intensify and accelerate the effort. I do think it's going to happen. A lot of things are happening in government, and also the UN system is beefing up its way to respond to this. Foundations like Aga Khan, civil society, and of course the scientists who are here. We want to do it based on science and evidence. I think that's the right way to get everyone on the same page.
I think this event will galvanize, will trigger a lot of partnership, a lot of momentum around this agenda, so that we will achieve greater impact in improving the survival of newborns and their development, and to make them productive citizens of Kenya, so that we see prosperous Kenya at the end of the day.